Regeneron CEO is warning against jumping to conclusions as the president touts the experimental antibody drug as a, quote, cure for the coronavirus. President Trump received the antibody cocktail after being diagnosed with the coronavirus less than 2 weeks ago. The drug is still in clinical trials. The company's chief executive responded about the president's case on Face the Nation yesterday.
So the president's case is a case of one, and that's what we call a case report. And it is evidence of what's happening, but it's kind of the weakest evidence that you can get, although there are some very interesting aspects of his case, such as he was elderly, he had some risk factors, and that he did not have his own immune system in gear when he was sick, and he got treated with our immune system in a vial, if you will.
All right, for more on this, let us bring Dr. Ron Elfenbein. He is an emergency care physician and author of Surviving Coronavirus, an ER Doctor's Perspective. Okay, doctor, just how much do we know about this treatment? What more needs to be done to show that the treatment is truly widespread, will be effective widespread? Because, you know, the president says that he wants to be able to get this out to people and he wants to be able to make it free, which means, I presume, that if it's available, it will be the treatment of choice. So what do we know about it?
Well, good morning. So, obviously it worked for him. So, but remember that he got a cocktail of medicines. It wasn't just the Regeneron polyclonal antibody that he got. He also got dexamethasone, and he also got remdesivir, as well as a couple of other things, a daily aspirin. He was taking vitamin D, he was taking zinc, all these other things that anybody can take. But obviously the Regeneron, the monoclonal antibody, is something that only was available to him. So, but it's really hard to parse out, well, was it that made him better so fast, or was it all this cocktail together? So to answer your question, what needs to be done? It needs to be a peer-reviewed study that needs to look at, is this effective in and of itself, without all these other things, and then how much better do people get, and how much quicker do people get? How fast do people get better using this versus not using it? And you kind of have to take all the other variables out, so you're just studying that one thing. The problem is, in this case, there were so many other variables that were put in place, it's really hard to tell which of those really made him better, if that makes sense. It's a little confusing, I know.
Well, no, it actually makes a lot of sense. I think that, the president kind of announced that he felt that was the most effective treatment. But based on what his doctors have told us, which is not very much, we actually don't know if that's the case or not. So you're making a lot of sense, doctor.
And the other thing, Doctor and Anne-Marie, is, it was an interesting report from our Holly Williams in the UK today that polled people outside of the United States as to why there have been spikes in other countries. And one of the things that they found is not that the idea of wearing a mask or social distancing is political like it has become in the United States. It's because people are confused. You hear one thing from elected officials or politicians or doctors, and then you hear something else from a public health official. And this is a case in point. Yesterday, in an interview with Fox News and on Twitter, the president of the United States said he'd overcome the virus and he is now immune. Twitter actually flagged that tweet as being a tweet that was providing misinformation, directing misinformation to people. No pushback, obviously, from Fox News. His physician also said the president is, quote, no longer considered a transmission risk to others. This goes back to my point, doctor. I mean, the president's claims, could they be seen as misleading, given the fact that he was diagnosed less than 2 weeks ago, given the fact that we know that people have become reinfected with this virus? And so I wonder if this confusion is partly due to the confusion that is exhibited by people like the president of the United States.
Well, Vlad, I think in this case, again, I'm not going to speak for him, but I think what he was talking about, in my estimation, would be that he tested positive for antibodies, which you're absolutely right that we don't know whether just having the presence of antibodies confers long-term immunity or not. So that was a very misleading statement for him to make. But my guess is that he was trying to just say, I have antibodies, therefore I am immune. That is a very misleading quote. I totally agree with you on that. He probably should not have said that, or definitely should not have said that. I mean, but I guess that's where he was going with it. And you're right. It's been very confusing this entire time. One day you have the CDC saying one thing. The next day you have the CDC completely reversing what they had just said. But I would, and of course, elected officials also, by all means, are making this more confusing. I would stress to your viewers, though, that it's not done on purpose. I don't think the CDC or the World Health Organization or anybody else is trying to confuse people. I think as data becomes available, things change. And this is a constantly evolving situation. And I think that, unfortunately, those kinds of things undermine faith that people have in these institutions. But it's by no means anybody's fault that that happens. That's just them trying to be honest with the people and society that, one day we say one thing and then more data becomes available and we're open-minded enough to look at the data and say, you know what, we were wrong yesterday. Today we've changed our mind because we just saw new data. So I think that's a really important thing to keep in mind. Obviously, the politicians are a completely different situation. I'm just speaking now of the scientists when I say that.
No, I think that's really good when people say, oh, you said one thing last month, you're saying something different. We're learning new things about the virus all the time. And, the thing about the president in particular, but perhaps others, is, he's not using scientific language. He's using very imprecise language. He said, maybe I'm immune. Maybe it will last, I don't know, some days, or I don't know how it will last. So you have to sort of look at, if you're looking for guidance on how to deal with this virus, and you're looking to the president, look at everything that he says to determine whether or not you're getting, precise instructions. And you probably find, or precise information, you probably find in many cases that he's talking very casually, and you should look to the doctors and the scientists.
Yes.
I want to ask you this, doctor. Researchers in Australia have found that the coronavirus can survive up to 28 days on surfaces compared to the influenza virus that is known to cause flu pandemics can only survive 17 days. What should we make of this information? Does this reinforce the fact that we should, also focus on sanitizing areas, surfaces where we're likely to touch and maybe touch our face and that sort of stuff?
So this was a very limited and, in my opinion, not such a great study, and I'll tell you why. Yes, the study did show that if the virus can survive on certain surfaces for up to 28 days. But it was in a sterile environment with no light. So we know that UV light kills, any exposure to UV light over time will degrade the virus. Killing is not really the right word because it's not really alive, but it degrades the virus to make it so it basically kills it, for lack of a better way to say it. It was done, again, in a sterile environment, meaning that there was nothing else there. So if I sneeze on a surface, there's mucus in that sneeze. There's white blood cells in that sneeze. There's other things that my body's producing that over time will degrade the virus. This study was looking specifically just at cultured viral cells that was with nothing else around it. So, it was very limited. Yes, we know that in a normal situation, the virus can live up to a certain period of time. It is absolutely not 28 days. So that study, while is sobering, is very limited in its utility for the average person. But yes, we should still be focusing on sanitizing surfaces, cleaning our hands, cleaning everything we touch. We should not, we shouldn't go crazy about it because this study is very limited, but we still want to make sure that we focus on those things because we all want to be safe and not catch the virus. And we know that you still can catch it from touching surfaces, but it's not going to be 28 days worth.
Dr. Ron.
See, that's why, Vlad, we have to listen to doctors.
I know.
Look at that was perfect the way you put that information in perspective, so that it's usable information in our everyday lives. We really appreciate that.
Yeah, and just listening to you, Dr. Elfenbein, I'm adding an extra happy birthday to you in my hand washing regimen. I usually do 2. I might add a 3rd one just to be safe. Dr. Ron Elfenbein, always providing information our viewers can use. Thank you very much. We appreciate it.
Thank you, guys. Stay safe.
You too.